Hi, I'm Dr. Brisley, and I'm here with Mike, and want to talk a little bit to him today about his experience with our clinic. He was actually born with a condition called craniosynostosis. And Mike, maybe you can tell us a little bit about what that means and
Sure.
what you've been suffering from.
So what it means is that at birth, normally babies have the sutures on the top of their skull, and they both close at the same time. It's the soft spot that the baby has. Ordinarily, those both close at the same time into solid skull bone, and one of mine closed prematurely. So my skull was kind of growing off in the wrong direction. So I have a slightly misshapen skull on the right side of my head. It also, either as a consequence of that or just sort of coincidentally with that, I had some problems with my eyes as well, where my right eye, when I was born, was completely shut, and my left eye was only slightly open, so I had to have a bunch of surgeries there. I had a deviated septum in my nose, and bottom line is that I had to have a lot of surgeries on my head, and the end result of all of that was that I don't focus out of both eyes. So I don't have binocular vision. I only look out of my left eye. And as a result, when I was a kid, I always used to walk with my head tilted to the right. And really not even just as a kid. I mean, for most of my life, I've held my head tilted to the right. And so that has lasted for a long time, obviously, and I've had, I'm speaking about it now as a related thing, but I didn't know it was a related thing at the time. But I've had these headaches for most of my life.
How many years would you say? How old are you now?
I'm 33.
And how long would you say you've had
As long as I can
headaches?
remember, it has hurt my head to lay down. I have a specific memory from when I was 6 that I couldn't go lay on the beach because it hurt my head. And
Could you sleep at night? Could you get in the bed comfortably?
I could sleep, but I can always remember that it would hurt when I lay down, and I can always remember thinking to myself, well, I guess that's just the way it is. It just hurts people's heads when they lay down.
So did you go to the doctor?
Not when I was young.
Mm-hmm.
I had bigger concerns when I was young. I had most of the surgeries, or all of the surgeries that I had, were between age 2 and 6. So, at that time, that was the focus. That was what we were sort of concerned about. And then I got into school and whatever. So, at that age, I didn't really go to the doctor much. When I was 11 or 12, I started having really severe headaches, and then I did go to the doctor, and they checked me for sinus infections, they put me on morphine, they did everything that they could think of to do, and nothing helped. In retrospect now, I understand why they weren't looking at the right things. And I guess that's where you come in.
How many doctors do you think you've seen over the course of your life for the head pain and or
Double
facial
digits,
headache?
double digits at least. Oh yeah, easily.
Were they all the same? Were they all internists, or did you seek specialty doctors?
Well, mostly I would have gone to just a GP, because when I was younger, I don't know, maybe for obvious reasons, I didn't really like going to doctors. So, I kind of kept it to a minimum, so I never really went to a lot of specialists. As I got older, and I started thinking to myself, boy, I really don't want to go through the rest of my life having headaches like this. Then I started going to specialists. So I went to a maxillofacial pain specialist in New York, who, did help me. Gave me some jaw exercises that I could do because I had TMJ problems as well. And, sometimes stretching my jaw out would take the edge off my headache, but it was certainly not a predictably effective way to get rid of a headache. So then I had, not necessarily directly related to this, but I also had to have jaw surgery because as part of my birth defect, my jaw was out of alignment, and I did when I went to a craniofacial surgeon and craniofacial orthodontist, told both of them about my headaches. They thought, well, maybe the jaw surgery will help it. I had the jaw surgery in February of this year. It didn't help. So then when I moved to Austin, I started pursuing the headaches thing a little bit more seriously, because I was like, well, if having this jaw surgery didn't help it, something's got to be wrong here. Something significant has got to be wrong. So I went to,
I was a neurologist first.
Right, I went to a neurologist. He referred me to physiatrist, I guess you would say,
Yeah.
physical medicine doctor, who then sent me to physical therapy. I also went to another craniofacial surgeon that's down here, who actually came up with an idea that was the first good idea that I think I've heard from, from one of the doctors that I've asked about my headaches. It turned out to be wrong, but it was at least a decent
An answer.
attempt.
Something, yeah,
right?
okay. Mm-hmm.
So, but then, for whatever reason, he was busy, whatever, I didn't hear from him for a long time. So,
What was the answer? What did he say?
he thought it was something called elevated intracranial pressure.
Okay.
Um,
And what was he gonna do about that?
He was going to drill a hole in my head
Okay.
and check the pressure, but what it is that with that procedure, the act of checking it also often relieves it, because what elevated intracranial pressure is it's an excess of cerebrospinal fluid in combination with blood and something else. There's like 3 elements to it. And so if you have high blood pressure, the reason you get a headache with high blood pressure is because it causes elevated intracranial pressure. It's just they have different sources. Commonly with people with craniosynostosis, you can have elevated intracranial pressure. Normally it's only in children, but again, at least it was something that's, correlated to me.
To you specifically.
And so
So you didn't
didn't
have...
hear from him for a while. I had been going to physical therapy, and that was helping, but not,
Solving.
not solving by any stretch of the imagination. So then my wife Melissa, who was also a patient here, had talked about the fact that when she was still up in New York before I met her, she had gone to an Atlas orthogonal chiropractor just for back pain. She didn't have headaches. And, she explained the whole thing to me. She was like, they do all these x-rays and they, they test you and they check your leg length and all this other stuff. And then they take this little machine and then they go, psh, and that's it. And I was like, oh, that's cool. Great. That sounds awesome. Glad you had fun with that. But, at some point, what it was for me is that I reached a point where my need to actually get an answer kind of overcame my skepticism, right?
Well, let me ask you this. Had you been to chiropractors before?
Certainly had. I had been to regular chiropractors.
Regular
Not
meaning
in-
full spine adjusting?
Sure, yeah, like where
Okay.
they lay on a table and push on your spine and wrap your arms around you and crack your back
Okay.
and whatever and do the little electrostimulus things. That was for back pain though. You gotta understand that, like, it had never occurred to me that my headaches could be related to my back. Like, I just assumed that my headaches had something to do with my birth defect or my surgeries, right?
So even by default, it didn't help the headache?
Right, yeah, no, it had no effect on
No
those.
effect, okay.
It was the laying down while they were adjusting me made my head hurt worse.
Mm-hmm.
But other than that, it was totally neutral. It neither helped nor hurt. So, then yes. So I'd only been to, I would say, a couple of chiropractors, mostly because I had lower back pain.
Did you ever tell them that you had a headache?
I don't think it ever occurred to me,
Okay, so
to
it's
be
not
honest with you.
completely fair, but...
Yeah, no, that's true. I mean, I did tell the most recent chiropractor in New York that laying down on my stomach hurt my head. So he made an effort to make it so I didn't have to lay down for very long, but he didn't try to treat it that I know of. So
Melissa referred you?
So Melissa referred me here, and I was like, yeah. So I got to a point where I was like, all right, fine, I'll try it. You know, what can it hurt? These other guys aren't helping me. You know, this craniofacial surgeon has gone dark. Like, he's just, I don't know, decided not to return my calls, and you know, he's too busy, and I don't know, whatever. And physical therapy is, you know, taking the edge off, but it's certainly not fixing the problem, and so on and so forth. However, the fact that the physical therapy had any effect at all actually helped me decide that coming to see you would be a good idea.
Because it was physical.
Because it was physical. Because it was physiological. In other words, that I went to this neurologist and he had me go and they injected ice crystals into the back of my neck, trying to help my head feel better, and it had no effect. So then when this was all going on sort of at the same time, I was kind of pursuing probably 5 different tracks of treatment. And when the neurological stuff, and he had me take a pill of some kind, that had no effect. When that was having no effect, and the physical therapy was having some effect, I was like, maybe this has a physiological cause to it, right? And so then I came to see you.
Okay. I'm going to put you on the spot just a little bit here.
Go ahead.
How tall are you?
6'3".
And how much do you currently weigh?
340.
Okay. Let's see if you can remember this. The very first time that I adjusted you, do you remember what you did? Yeah. Immediately. What did you do?
I bounced up out of my seat.
And what did you say?
It was like, it's like, to me, it's like the difference between moving with a heavy backpack on and then suddenly taking it off.
Okay.
If you're walking around with a backpack on and you cut the straps and just drop it, you're all of a sudden going to feel like you're on the moon and you can jump. And that was how I felt.
And how many treatments was that?
That was one. No, that was the first time.
Very first time.
Yeah.
Okay. And so how are your headaches now?
My headaches now are probably about 10% as bad as they were 2 months ago.
Meaning 90% gone?
Yeah.
Okay.
And that's both in terms of intensity and how often I have them. So I occasionally will get to a point where, and to be, I still have bad moments, no question about it. I went on vacation when I wasn't seeing you for, well over a week. It got back to being pretty bad. But, on normal times, when I am just, doing my regular stuff and seeing you regularly, it's a fraction of what it used to be, definitely.
Thanks for sharing your story.
No problem.
I really appreciate it.
Yep.
Okay,
Happy.
Thank you.